The most common question is what type of implant is best going to suit my body? So when we look at implants, we've got a number of choices to make, whether it's a smooth, whether it's a textured implant, whether it's a round, whether it's a shaped or anatomical implant, and also how firm the gel is. As a very rough guide, we want the gel consistency to match the breast. So for a young woman with a firm breast that is wanting to boost her size, they're often got quite firm tissue, and we need a firm gel to really impact that and work with that so that it feels like a single entity. Whereas another lady who may have had a couple of children, never really gained any weight and has a soft, more mobile breast, we need to put in a softer gel, something that's not going to be feeling as though it's separate from the breast. We don't want to have a rock and a sock. Almost to a person, women are wanting to feel more feminine and just happier with their appearance in the mirror when they jump out of the shower or something like that. There are a lot of popular myths. People don't generally come in wanting to have huge boobs. They come in wanting to be feminine. And whether they've got a very small breast or whether they're disproportionate, their breasts are small for their frame, they just don't feel they have body balance. And for most women, it's seeking body balance.
So the most common question I would get asked in relation to my patient population is the concern about whether they're going to still look natural after having this sort of surgery. Majority of my patients are those who are looking to rejuvenate their bodies after having children, and they sort of don't want anyone else to know that they've been through this. They just want to get back to where they used to be before children, and they just want to know if that's actually achievable or not.
The most common question I get asked by patients seeking breast augmentation surgery is the longevity of the result. And this comes down to two things: how your body is going to respond to the implants and how long the medical device actually lasts. So when it comes to breast augmentation surgery, the implant will stay the same, but your body will continue to change through weight gain and loss, having children, getting older. So the most common thing is that a woman might need a breast lift or an increase in size of implant to soak up some of that increased skin laxity. In terms of the medical device itself, most patients are concerned about hardening of the implant or capsular contracture and rupture. By picking a specialist plastic surgeon, you are reducing your risk of complications and revision as much as possible.